Hi, my name is Tammy Burns, and I'm doing my topic on the safety of vaccines, childhood vaccinations. Having your children vaccinated is the safest and most effective way of protecting them against the childhood diseases. Staying current and up to date with the immunizations is the best protection against your uh, infectious diseases for your child. Parents should vaccinate their children. Vaccines are safe, effective, and inexpensive. The safest and most effective way to protect them from serious diseases is to have your children vaccinated. Vaccines provide the best protection against diseases. According to Centers for Disease Control and Prevention, vaccine preventable diseases are currently at a near record low. If there's not adequate vaccination coverage in the community, even vaccinated people are at risk for contracting diseases. It's important for the vaccine safety to have ongoing monitoring and continuous data collection to ensure the assessment regarding the risk and benefits of vaccines is occurring. According to the CDC, there are several steps to ensure the safety of vaccines. Pre-licensure vaccine safety studies undergo extensive evaluations. There are several phases. Phase 1 consists of human clinical trials that involves 20 to 100 volunteers, and they are looking for side effects in this phase. Phase 2 consists of dose and the number of doses that are given to the volunteers, and they're looking for the effectiveness in this phase. Phase 3 consists of collection over several years of data and research. The manufacturer can apply for license in Phase 3. There are several networks set up that also come alongside in Phase 3. One is known as Clinical Immunization Safety Assessment Network. And there's one National Childhood Vaccine Injury Act, and that is holding people accountable or accountability for the vaccinations for adverse effects. Vaccine Adverse Event Reporting System is known as VARS. This is very well known and popular. Pediatricians and parents are encouraged after their child is vaccinated, if they have any suspicion of any adverse effect, they are to contact the hotline number, and that's how they collect their research and data. Although vaccines are monitored continually for their effectiveness, immunization providers have an important role to ensure the safety and effectiveness of vaccines. One vaccination in particular that caused concern in the late 1990s was MMR vaccine, where they thought it might have been linked to autism. There was a researcher that lived in England known as Dr. Wakefield in 1998 that had researched some faulty information, and that caused a concern in the parents whether to follow the recommendations for the vaccines. Parents became concerned after this faulty information was released of vaccines causing autism, and at that time it caused the vaccination rates to decrease regarding that. Another important step in the vaccinations, the storage and handling of vaccines. It is imperative to have the best possible results from the vaccine if they're stored and handled properly. The recommended temperature ranges, if the ranges do not stay what is within a recommended temperature, it can decrease the potency of the vaccine and be less effective. Failures to handle and store the vaccines incorrectly result in wasted vaccines, increased cost, and revaccination. Health insurance plans. Most insurance covers vaccinations. So whether the families are low income, it's important to educate these families with information regarding the vaccines, the importance, and um, let them know the programs that are out there to assist them if they do not have health coverage, that there are programs and funds are allocated through Centers for Disease Control and Prevention and Office of Management and Budget to help assist these families with vaccinations. Declining vaccines could be very, very bad for the society as a whole. The benefits far outweigh the risk. An increase of serious infectious diseases such as whooping cough, hepatitis, and bacterial meningitis. And we've seen an increase over the past couple of years with those coming back because of parents not vaccinating their children. Knowledge is power. If we can, as a healthcare system, pediatricians, doctors, nurses, reach out to these families in the birthing centers and make sure these parents leave equipped and ready to handle the care of their new baby. Educating them and letting them know the importance and that it's imperative to have your children vaccinated from these childhood diseases and to prevent spread to others in the community of children that are not vaccinated. Um, Allowing them to know that, or educating them with side effects when they do get vaccinated, what to look out for, when to contact the pediatrician or the hotline, the VARS hotline. I feel as a community and we should come together. Education is key to having your children vaccinated to give them the best start possible in life. Thank you.